Today, we're joined with Dr. Scott Baylin of Catonsville Dental Care. Scott, thank you so much for joining us today.
My pleasure. Thanks for having me.
Absolutely. So, I know that there are some patients out there and they look at themselves in the mirror, or maybe they see a picture in which they smiled, or maybe they don't smile for pictures, and it's because they don't like the look of their teeth. But they're an adult now and they don't really know what they can do about it besides metal braces. What would you tell that patient?
We hear that all the time. People just assume that they need to put metal braces on their mouth in order to have the smile that they've always wanted. That is not the case. We have an amazing piece of technology that is at our fingertips, and that's called Invisalign. And Invisalign gives people the opportunity to have the smile that they've always wanted.
Now, I know when I was a child, and I guess I didn't wear them long enough looking at my teeth, but I had braces and it felt like a lifetime that I wore these braces. This Invisalign process, is this a really, really long process they're going to have to work through?
It's actually not as long as you think. The majority of the cases that we do are orthodontic relapse, which means you had braces as a child and then you didn't wear your retainers, you lost them, didn't fit, whatever. And then now you're noticing these changes, and those changes continue to get worse and worse. So we have the ability to do a pretty short treatment, relatively short, I'd say, 6 to 9 months. The majority of our cases fall into that because we're really not correcting any posterior occlusion, which means your back teeth. If your bite is stable and secure, we're really making your anterior teeth and your premolars really uh, get into the proper position so that the smile looks great while maintaining an amazing bite. So really probably 80% of our cases are complete within 6 to 9 months.
Wow. So what's good about that, I'm just thinking if someone has an event coming up in their life that maybe is a large life event, maybe a wedding, graduation, maybe some significant anniversary, they know it's coming. It's farther than 6 months down the road. You can actually do something to help that person really love their smile for this major event that they're going to have pictures for the rest of their life. Am I wrong?
No, you're 100% correct. And a lot of times we'll talk to a patient about Invisalign at a hygiene visit, and then they come back in the next time and they look at me and say, you know what, doc? If I'd have started this 6 months ago, I'd probably already be done right now. And I say, you're 100% correct. The sooner you do it, the easier it is. The longer you wait, the more correction needs to happen.
That makes a lot of sense. It's interesting. I wonder if there's anybody watching this right now who's saying, man, I wish I had done this 6 months ago because of this that's coming up. What I would say to that patient is a lot of things are going to come up in your life. So it might make sense for you to reach out now and get that taken care of.
I
Um,
would agree.
so what about the most common questions that you get that ends up being the biggest surprise to patients? What surprises patients the most as they go through this?
Most of them are surprised how easy it is. There's pretty much one hour appointment in the beginning where we do what we need to make the teeth amenable to change. And then you come in basically once a month and we monitor things, make sure everything is looking great, give you your next sets of trays, and then you come back in. And once everything is complete, then we do a revision scan if we need to. We send that out, and then if everything looks perfect, great. We go ahead and we get you your final retainers to keep everything in the same spot, so you can have the changes that we've made happen. Keep those forever.
Hey, speaking of the scan, what fascinates me about this and the difference between this and braces is braces are the same for everybody and they get glued on and then you have this wire put in and rubber bands. But this device is created because of the scan you did, correct?
That's correct. It's completely digital. We scan you, we send that off to Invisalign. Invisalign then gives us back a ClinCheck, which is a digital analog of what you look like and all the movements that are going to happen. We make our modifications as necessary, and all those changes again are done virtually. And then once we approve everything, it comes back to us and we have your whole case in a box. And it's just incredible that plastic can move your teeth. I'm always amazed that the forces that Invisalign is able to put on the teeth actually works. It's just incredible.
That's awesome. I want to talk about a patient out there that actually knows this type of solution exists, and they may have spoken to someone else about it. What would be a sign that this patient should get maybe a second opinion from Catonsville Dental Care based on what their experience was somewhere else?
That's a great question. A lot of times people think that orthodontics is going to take multiple years in order to get it accomplished. And I would say people are very surprised that most of our cases are considerably less than a year, and again, fall into that 6 to 9 month range. There's a lot of things that we can do based upon the experiences that I've had, based upon the training that myself and all the other doctors in the office have done in order to shorten those treatments so that you get the desired outcomes without all the longevity.
So I know that the main reason someone does this is because they don't like their smile. And like I said earlier, they're either hiding it from pictures, they don't smile that big, but there's actually an important health aspect around this process as well. Can you walk us through that?
Absolutely. I'll be happy to. So there's a couple reasons that people usually want to get into orthodontics, and that's because they're not happy with their smile. However, when we do our iTero scan on you and we show you what your mouth looks like on a 40-inch monitor, we get to show you what it is that we don't like. And usually what it is that we don't like is a crowding situation. And the reason crowding is so problematic is because you're not a hygienist. You're not able to keep those teeth clean. And so the more crowding that you have, the more nooks and crannies that are in there that are impossible for you to keep clean. If you can't keep them clean, then we develop problems. And those problems are recession and bone loss. And once that happens, root surfaces become exposed. And when root surfaces become exposed, we know they're highly prone to getting cavities, and that the gum disease will only exacerbate the situation. So if we can get in there and put all the teeth in the proper position, straighten everything out, you're going to find that your hygiene visits are super easy. You're going to find that your breath is better. You're going to find that your smile is better. And overall, you're going to be extremely pleased with how things look in the end.
That's a really fantastic point. And what I want people to think about is imagine months or years from now needing significant dental work because of crowding that could have been avoided by fixing also what you don't like about your smile. I mean, that's really powerful.
100%. Can I add on to that a drop? So what we see is that the majority of people's dental disease comes from one of three things. And the first two are pretty obvious. It's lack of hygiene and it's diet. So lack of hygiene leads to periodontal disease and also cavities. And diet also increases the risk of getting cavities. But what I've found in doing dentistry for over 20 years is that bite is extremely crucial to having an overall healthy smile for the rest of your life. Because what we see is that crowding only gets worse. And the majority of people's crowding is where they develop those problems. So the lack of being able to perform proper hygiene in those crowded situations. Or on the other hand, you've got spacing. So you're getting food trapped in areas. Guess what? You lose bone, you lose gum, roots are exposed, problems happen. I spend more time fixing people's teeth down the road later in life when all of this could be avoided by putting their teeth in the proper biting positions. Think of it like gears that are running through, and constantly those gears are grinding together. You want them to be as easy and seamless as possible. Otherwise, one of three things is going to happen. Either the gears are going to break, or wear down, or they're going to move to the side. And that's what happens with our teeth. The crowding just gets more and more crowded. the spacing gets more and more spaced, or there's no room for them, so they move front and back. And you'll see that all the time where teeth are forward and backwards. They have to get smaller, make themselves smaller, so they twist, turn forward, backwards, or break. And almost all those things can be fixed by putting the teeth in the best biting position that's achievable through orthodontics.
Wow. What would a patient notice about their own teeth to know that they're heading down that crowded path?
That's great. I would say there's a couple of things. Are you noticing that your teeth are chipping and breaking? Are you noticing that your gums are receding? Are you noticing that there's little divots at the top of the root surface where you never experienced those cavitations before? We call them abfraction lesions, which is a very big word for basically the force is bad. Because when you bite, every time you bite down, if things are good, fantastic. However, when your bite collapses and you get collapsing of the bite from a posterior aspect, now if it's not in alignment anymore, now you're getting this. Every time you're getting this, you're getting divoted areas. And I used to just think that was from people brushing their teeth too hard. That is not the case. The majority of the time, it's because their bite is not set up in a favorable manner. So if you notice any of those things happening, you should be making an orthodontic consult in our office so we can talk about it.
How would you do it? Like, how would you just bring it up to me if I was an existing patient?
Okay. If you were an existing patient and you were in my office and we did a scan on you, I'd be able to show you the things that are concerning me and my hygienist. And I think some of the things that we would talk about is, where do you have recession? Where are your teeth breaking? Are things wearing down prematurely in certain areas? Is your bite unbalanced? And we call it a weather map, and it's basically an occlusal chart that shows you where you're hitting. Are you hitting particularly hard on one side? Are you hitting particularly hard on one tooth? Are areas wearing? Are your gums receding? And we can notice those changes by doing a contrast and a layover where we can show you, this is what it looked like this time, this is what it looks like now. Here's where the change is occurring. How do we put that to an end? How do we arrest that situation?
So, as most people know, humans sometimes aren't the best at thinking into the future. We probably don't exercise as much as we should. We probably don't eat as healthy as we should. And there is a personality type out there that probably avoids a dentist unless it's gotten to the absolute worst case scenario. So for that person out there who's thinking, okay, this could help me avoid things in the future, how bad of an experience is using Invisalign? Is it a really painful process? Are you making me do impressions by filling my mouth full of goop? Is it going to hurt? Do I feel claustrophobic? Like, what are all the negatives?
Sure, I'll tell you the negatives. The worst part about being in Invisalign is that you do have to wear the trays 22 hours a day. You must be compliant. If the plastic's not on your teeth, it is not going to work. And that's just a fact. I need the patients to be compliant, but if you give me a good 6 to 9 months, I'm going to make you really happy. And you're going to see at the end that your efforts are going to be worth it. We no longer have to take impressions anymore. We do everything digitally. The only things you need to do to get started with Invisalign in my office is to do an intraoral scan of all your teeth so we can create a 3-dimensional digital image of you and photos. And those are extraoral photos where we analyze your profile, your smile, your lip line, and the teeth from an internal and an occlusal aspect externally. And that's all you need to do to get started. After that, it's just listening to myself and my assistant as we walk you through the process. We hold your hand. If for some reason something gets off track, not a big deal. Scan you again, send it out, no extra charge, come on back in. We understand. People make mistakes. They go for a while, they lose a tray. It's all good. We are human. We know that you are human. We're here to help you get the smile that you want and get it in a timely manner.
So the patient out there, they've been thinking about it. It sounds like the best thing for them to do, call, book an appointment, and get that scan, see what this looks like for them. And I mean, just think 6, 9 months from now, you could be smiling big in pictures, in the mirror, and also avoiding pretty significant dental problems. And people are not a fan of those two terms. Dental problems does not sound fun.
I agree. I used to sort of avoid treating patients when I saw that they had crowding. And it's not because I didn't think they needed it, it's because I didn't think they really wanted it. But now I'm seeing, I've been doing this long enough that my patients that were 50, they're now 70. And I wish I knew now I knew then what I knew now. And that is that if I can fix your teeth at 50 and put them in a proper position, I won't have to do a lot of work on you when you're 70. My goal is to do as little work on you as possible. So if I can put your teeth in a good biting position so you can maintain the health of those teeth, we have to do almost nothing for your teeth. You're going to come in for your cleanings. They're going to be so easy. And you're going to say, I can't believe how easy this cleaning was. I wish I'd done this 20 years ago. And we hear that all the time. Even when people are halfway or 3/4 of the way through their treatment, they're like, this is so much easier than I expected it to be. I wish I'd have done this 20 years ago.
What is the age that someone shouldn't do this?
So I don't treat any early teens. I don't do any orthodontics on anybody that's still in a growth phase. So, but once they're out of the 14, 15, 16-year old, not a problem doing orthodontics on them. And look, if you get to 85 years of life and you've been doing just fine, very rarely am I putting orthodontics on an 85-year-old. At that point, it's a risk analysis and a cost benefit. But look, if you're 50, 60, even 70 years old and you think you got another 10 years, then 100% put braces on your teeth. Why not have the rest of your life with healthy, straight teeth with the smile that you've always wanted?
So a patient, they finish their Invisalign, everything's straight, they like it, you're happy. That's it, right? They don't get anything else.
No, actually, a lot of times when we're done with treatment, because their teeth were in an unhealthy position for so long, they've worn edges down and it doesn't look exactly the way we want. So we're able to manicure those teeth just a little bit to smoothen off some rough edges, to eliminate some of those sharp line angles that just don't look good because you've been wearing those teeth down for so long. And then at the end, we also whiten your teeth so that they just pop. We want you to be the biggest advertisement ever out there, walking around showing off your smile to everybody.
But that's got to be an extra charge, right?
Oh no, that's included. It's on us.
Wow. Very strong. So someone goes through this process. They had teeth and now they have been remodeled into these new positions. What other kind of things are you seeing from an impact to their life?
Yeah, that's a great question. We we see other changes besides just them having their teeth in a straight position. They now can smile and do their biggest smile that they've always wanted. So that helps them from a mental capacity as well. If you're unable to smile fully in social situations, you're not able to live your best and fullest life. We want you to live your best and fullest life and not be ashamed of your smile. In fact, I'll tell you a little bit of a story. We had someone in the other day who we were talking to a Botox trainer about, and she also does fillers. And she was pointing out on this person's face or this person had pointed out on her face what her chief complaint was. And her chief complaint were these lines that she had coming down from the corners of her lips. And she said, okay, well, show us when those are the worst. And she went like this. And she made this face. And we're like, well, when do you make that face? She goes, that's how I smile. I said, hold on, let's back up. Why are you smiling like that? She said, I hate my teeth. I said, well, let's fix your teeth. Let's put your teeth in the proper position so that you like your smile, So you do your biggest smile, so you're not forcing your lips to stay together to prevent you from ending up with forever lines in your face. Let's fix the problem before it manifests in your face.
Wow.
Right?
That is wild.
So here this Botox trainer wants to put Botox and filler in her. That's just covering up the problem. That's not solving anything. The only thing is, yeah, she's not going to have those creases there anymore. But guess what? Those creases are going to come back. Let's change it. Let's flip that smile. Let's make it go upside down. Let's make it go the right way. And she's not going to have those same things. Sure. Then she might be smiling more. So she's going to want to do a little stuff in her.
Yeah, she got the crow's feet. Yeah.
Now she's got the crow's feet. But she's never done a full smile in her life. That's not a fun way to live.
No, that's life-changing.